important group. So welcome. Thank you very much for joining. I know it's a busy and Sunday. I won't take much of your time. And I just wanted to quickly run through some of the salient features of this upcoming Sydney Observership program, which both me and Dr. Tom had been working tirelessly over the last few months. And finally, we've got to go ahead to have it, delivered. And we've got an organization, and I think it's very exciting the way that we've devised it together. And I thought we will go through it, some salient features. Let me just bring up my screen if you don't mind. So can you see my screen, everyone? Perfect. Excellent.
Yes.
So what are we doing is we basically doing this program over 4 weeks. And without getting into the nitty-gritty of the details, I'll tell you everything. So you can keep on looking at me and rather than reading this all. So it's a 4-week program. And we are going to be, having a proper organization this time with this program. So you'll have proper assessment, you'll have proper feedbacks with your GP clinical supervisor. We've actually partnered with MyHealth, who are the large conglomerate in the Western Sydney, and plus they've got other areas, GP practices in Victoria, in Queensland, and other areas as well. But right now, we're just starting with Sydney. We just want to concentrate till we excel this program. And they've got like various awards in terms of educational supervision of the year. So we were more looking for a partner who can really match our sort of enthusiasm in terms of teaching and training. So they came up to be the closest one from that point of view. Now, in addition to the face-to-face program that you're going to do, we also decorated this program with weekly mentorship teaching. So I'll be here every week over Zoom talking to you guys. Tripti, what case have you seen? Can you tell me something about my case? You don't have to prepare anything. You can just come and look, oh, Dr. Rizwan, I saw this case and I think it was very interesting. The way it was managed, the way it was assessed, the way it was referred, it was quite unique. Mm-hmm. And where I come from, it would have been very different. But here I got to learn point 1, 2, and 3. Then I'll ask you some questions regarding the case and what it make you learn differently in terms of your own, clinical practice if you'd get that case. So I think that in that way, we can layer up an additional level of learning, if that makes sense. Yeah. Obviously, resuscitation workshop has been very popular. So if you've done it, great. If you've not done it, you'll do it again. So that's good. And I've got a radiology workshop which is coming up. So one of the things which I really find very interesting when the GMOs are coming and working with me in the hospital is that their assessment of basic x-rays, their description of x-rays, how they're going to tell the findings of this x-ray or describe the findings of the x-ray to orthopedic registrar, to the consultant. So I think it was very important to have that basic emergency radiology approach. So that is also incorporated in that. Plus, we've done this clinical orientation course, which is a big resource now. It's got like everything that you need to do in a hospital setting, in addition to, adult resuscitation workshop. It's got like, it's got pediatric workshop, it's got cardiology workshop, it's got psychiatry workshop, it's got like, it's this big, huge resource, which is just complete. So I've been receiving messages from some of the people who've been now working in the hospital. They've just restarted fresh and they've been struggling. And it's a real thing. You may think that getting to the job is your end goal. Yes, it is. But there is a significant amount of work which needs to be done. And I think that orientation course really prepares you what to expect, how to present, and how to conduct yourself professionally when you're working on the floor in a hospital setting. So it's important to go through all the modules in the clinical orientation course, and you'll have them for a year. So no problem on that. Then I've thought that, look, doing this interview guidance for about a good part of 2 years now, I'd like to take it further. I'd like to do like this one-on-one interview and application and CV things. So what we've decided is we'll do end closing ceremony for the certificate distribution and everything. but we'll make a very productive day. We'll do some mock interview so we can sit down, we can have one-on-one interview session. We'll do application and CV discussion and all of those sort of things. So you guys are ready. You've gone through the clinical observership program. You've done your clinical mentorship course, or you are doing your clinical mentorship, or you've done your radiology, you've done your basic emergency skills. And then obviously when you get your certificate handed over in terms of 100-hour CPD, it's also based on a lot of face-to-face interaction, which comes from the GP point of view, and also when we're doing that final day in RIVSB workers. And then look, the last important thing is that you should have references. There's been always a concern that, oh, I have not been able to get references. So in order to do the references, please establish good ties with your GP that you're working on, their educator. And in that way, you can develop a very close personal reference here in Australia who can vouch for you, who's working as a doctor here in Australia. So that's actually pretty special. And I'm going to be doing references as well. And there's one more exciting thing, which I'll tell you at the end, which we've really tried very hard. So let's take, so how is this program? Like, obviously there are quite a few requirements, but none of them are quite, it's very simple. You must have passed your AMC1. COVID vaccination is a requirement. You should have a valid visa or a permanent residency or a citizenship. That's not a big issue. Even if you're here on a visitor visa, it's completely fine. It's an observership program. You're not really working. Obviously, you should have good communication skills because that layers up your level of presentation and engagement. And we're going to, because we've had quite a bit of response, so we'll conduct a small interview. Shouldn't last more than like 5-10 minutes, but basically a quick set of questions. Why do you want to join it? What do you think it's going to help you with? Where do you live? Which basically my interview part is just to make sure which practice you want to select. That's my main interest because there are only a handful of spots. So by talking to you, I'll have a better idea that how you can commute, because I want you to attend all those sessions. You're actually paying for those sessions. So when you're paying for the session, I want to make sure that you maximize those sessions. So logistically, how it's going to work out. And there's a lot of flexibility in this program as well. And I'll tell you a little bit more about it. So that's what it's all about in terms of how it's going to be done. So you are basically doing, 2 4-hour sessions per week. Now, each 4-hour session, it can be in the morning, it can be in the evening, it can be during the weekday, it can be in the weekend, it can be both in the weekend, can be both in the weekday. So there's a lot of flexibility. But what I wanted to do is work with your GP supervisor. Where do you want to, and how do you want to work it out? You may like to, you may already be working in some setting and you may have a fixed timetable. So I would like this program to work with you as opposed to be an additional burden on your current life. So if you think weekend suits you better, afternoon suits you better, fine. But having said that, I think mornings are better in a GP setting because that's where, when a lot of patients present, there's a lot of bookings, there's a lot of walk-ins. So if you want to really learn and grasp the total clinical exposure, then mornings would be to go. So at least make sure that you're doing the morning session consistently. My personal advice would be to fix up a day. Like make sure, like if you want to do fix up a Monday, fix up a Wednesday, or say for instance, just fixing your time, you can work your schedule around it rather being completely flexible. It'll just completely throw everything in disarray. And look, MyHealth GPs are quite resourceful. They've got like this patients flow, they've got procedures, they've got wound care, community dressings, community vaccination. So there's a lot to take in. And if you understand the complete workflow, I can pretty much vouch that more than 2/3 of you are going to be GP. That's what general consensus is amongst IMGs. They like to be their own boss. They'd like to practice. So they could be your future employer. The way that they're taking over throughout Australia, it's not unusual that you might be working in some sort of partnership with someone, MyHealth. So this would be a very good and up and close personal chance to see how the GP work is like. Is it something for you? And how you can assess all the areas of workflow and how you can really take them on. There are going to be some counseling session and the patient referral process. I want you to observe those GPs and see how you learn from them. Where are the placements? So we've got 2 spots in Parramatta, 2 spots in South Everleigh, 2 spots in Auburn, 1 spot in MacArthur Square, 1 spot in Oran Park, 1 spot in Warringah Mall, and 1 spot in Wetherill Park. So the total 10 spots, right? Is that right? Yeah. So 10 spots in total. And hopefully these 10 spots will fill up very quickly after the interview process. As I said, very flexible, work out your things. So what is your expectation? I think this is what you should expect. You should have like a personal management, a personal learning plan. So acute and chronic health, pediatric health, women healthcare issues, just make a list of things that you would like to learn in those 8 weeks and make sure that you are in complete understanding of those pathologies, how their history is taken, how their examination is conducted, how they're managed in a practical way. And those of you who are sitting for AMC2, this would be a very good opportunity to actually see those practical things. And if you're doing your AMC Clinical 2 course, it will completely embed in your mind that this is what I've seen. Like 30 to 40% of the cases of MC Clinical 2 are GP based or primary healthcare based. So by watching and observing those cases and then practicing those cases in your sessions, it would completely embed in your memory and you don't have to sort of repeat them over and over again. The only thing is that you have to be proactive. That I keep on saying that this is a very important thing. And that's why we very carefully selected this program. There'll be procedure skills, so you can observe those procedure skills in those. And when I say burns dressings, there'll be sutures, there'll be suture removals, there'll be dressings of the chronic venous ulcers, there'll be also dressings of some of the skin cancers and removal of the skin cancers. So you've got a lot happening in there. The quite a bit intricate women procedure that you've heard about in AMC, they will be happening there as well. So there's a very good exposure from that point of view to be have and learned and embed in your learning process. So I would encourage all of you who are serious to maintain a logbook and target that this is what I've seen. This is what I've cases that I've seen. This is the procedures that I've seen. And we'll provide you with a template of that logbook, and it's all going to be online. So you don't have to worry about, oh, I have to make a logbook. We'll provide you with that template. And part of it, when you're doing your reflective learning, then that logbook will get populated and it'll be very easy for us to give you a reference. Okay. Expectations from you: be punctual, be professional, dress up smartly. If the GP is asking you that, look, this is a GP, like if the patient requests that, look, I'm not comfortable, don't mind it. Some of the patients are like that. But there are going to be plenty of patients. It's not going to be like that you're sitting in the waiting room or anything like that. You'll be shadowing. But I think the amount of engagement you show towards a GP, they will be more comfortable in delivering or having you more on board along with their patient. So, and fluctuate yourself across all the areas. You're in the clinic, you're in the procedure section, you're in pathology, you're in, whatever it is, it's just you get rotating around, and you're only there for 4 hours. So these 4 hours will go by very quickly. A typical GP works for about 8 to 9 hours. They see about 50 patients. So if you're spending half of that time, you'll at least see 20 patients. So that's a lot of patients to churn through. Fair enough. Most of them would be very simple, but the learning is to be had from everyone. And if you are doing that regularly, you'll see that pattern of patients presenting with problems and follow-up and referral and all that kind of thing. There'll be a lot of mental health, which is a very good aspect of learning, especially in the primary care setting, because these are the patients who actually benefit from GP level intervention, and they're working quite independently in the community. Any questions at this end, guys? No. All right. I'll give you so what about this meetings, weekly mentorship meetings? So the way that we're going to do weekly mentorship readings, just give me a second. You can still see my screen, right? Okay. The way we're going to do this a mentorship meeting is that it's going to be in, 1 hour Zoom meeting. You're going to just get a case that you've seen and you find interesting, you do not have to prepare a PowerPoint presentation. You just have to write it down in your notebook that this is the case that I saw. This is what I learned. These are the questions that I've got. And then we'll discuss it amongst the 10 of us. It's only give me 10 of you. So 10 of you and one of me or Tom, and then we'll go through over that case. And if you got questions, we'll take up those questions and we'll take it. So that case becomes a group learning exercise. So if anybody has seen a case, then they can discuss this case and then it'll become a group exercise in terms of learning. And Tom's idea was that it would be good to like reflect that kind of learning, like what is the difference between managing that case here in Australia versus if you've seen that case managed in any way in India or have got an understanding, how could that be a different one? Okay, so, all right. Okay. Okay. All right. Now, how will you get a reference or how would be a successful completion of the program? You should complete 4 weeks of GP program. It is 4 weeks. This is what is tied to your CPD certificate. Tom is working with the GP to have an assessment form for all the participants. So GP educators will have an assessment form. They will do that form and they'll give it to you. Attendance and completion of the adult resuscitation and radiology workshop, which are both in the month of August. And I think, yes, they're both in August and September maybe. And attend all sessions. Just make sure that you don't miss any. You're paying for that. Work out your schedule. There are only 2 sessions, 4 hours each. It should not be difficult to get them ticked off. It's a very important opportunity. And then based on your interaction and engagement, the GP will give you a reference, I will give you a reference, and Dr. Tom will give you a reference. So you should have 3 references on your CVs. Okay. Yes, so this is my thing. I thought that it's good to see you in person as well. So we will have a half a day on a weekend after the program finishes, and we'll sit down and we'll do interview practice. We'll sit down and go through your CV. What is lacking in your CV? How we can optimize that? We sit down and go through the application form responses. So that personalized level of career guidance is there. So you're not panicking if you're getting shortlisted. Oh, I have not practiced interview. I think at least we'll have a session done to give you an idea of how to do an interview at your level, and then we can further build upon that. I will give you the date. This program runs from August 26th till September 26th or thereabouts. It would be the next Sunday or the Sunday after that. So might be the first week of October, the end ceremony, and we'll make sure that, it's a proper ceremony. You'll get good food, you'll have a good learning, you'll have a certificate. So something to remember. Now, there is one thing which I'm very excited about. We have been having a discussion with one of it's not full and final, but it's almost final. So there is a opportunity for some people of this program to join as a physician assistant in an emergency department. And now that's going to be a paid job. And it is basically involving you going with the emergency specialist, seeing the patient. They will give you a teaching on their own software, how to type the notes, and they will provide the training. You do that job depending on your mutual agreement with them. It might be 3 months, it might be 6 months till you get yourself a job, but it would be a paid job in a hospital or a major clinic setting in a private emergency. So, and then you can obtain additional reference from there. So that's again very good. So this is something which will come handy if you are looking for a job, which is a paid job after this program. As I said, they've promised us at least 1 or 2 positions after the end of the program, but there might be more. And they normally say that we'd like the people to stay in for 6 months. I said, I'm not really sure about how the preferences are, because these are the doctors who are looking for the jobs in New South Wales Health. He said that, look, I'll be providing them training in terms of medical documentation, how to use the hospital software and how we see the patients, how the template is. So it's a lot of investment on our part. So we'd at least like them to have them for at least 3 months. They're currently using New South Wales medical students, university medical student, but because of their exams, they're not having consistency. So they really like to hire someone with a bit more consistent and reliable approach. So again, a good opportunity to be employed after that. So yeah, I'll finalize some of those things as the time comes closer. Any questions at this end?
Hi, Dr. Rizwan. This is Tida.
Mm-hmm.
Yeah, I just want to ask you because I actually I'm residing overseas, right? So basically, if like instead of 1 full month, like, can I do like 2 weeks, like every day basic,
Yeah, I think the way the CPD hours are structured and
Yeah.
the way that we have talked to our partner, the MyHealth GP, it would be difficult to just do half the program and not be there, because it is quite a deep level of engagement. You're showing a very important commitment by doing 2 weekly sessions. But not only that, you're doing one weekly online Zoom session, then there is mentorship meetings. There's quite a lot going in through. So I think you'll be missing out 50% of the face-to-face value, which is a big part really, and you'll be paying for that. So I don't see much value. Maybe don't worry about it. Next time when you're back in Sydney, you can look into it, registering for it at that time.
So would that be like is it possible in how many sections would you run in a year? Like out November, December, is that possible?
Look, we want to make it a routine as much as we can. Right now, because we are not the only people doing it, it is also MyHealth. And they'll be collecting a feedback from you guys and from us as well. So it really depends how you guys feel supported, what was the learning outcomes, and how those feel supported, like it helped them. And as I said, it's a big opportunity, and you would be having a lot of opportunity to they're your future employers, right? They're your future employers. You might be getting a job from them. You might be getting a job offer from them. So there's a lot of investment from both ends. So we'll try to have it. I would like to have it every month. Every end of the program, have a 2-week grace period and do it again. But I think I don't like to make like a solid commitment right now. I can promise that this program is going ahead, and based on the feedback, we would be launching another one. When would exactly that be? I'm not able to be 100% sure. So I'm royally focused on this one as our first born program, and we'll see how it goes after this.
Because I really want to join in August, because I plan to sit the pesky in end of August or September.
Oh, that would be very good for you, isn't it?
Yeah, but the thing is, I am like working full time and mother, so it's very hard for me to leave the kids overseas alone. Yeah. So is there any other way that could you? I can do actually in Sydney, and yeah. But the thing is like how to squeeze out my leave, and like.
Yeah.
Is there any idea that you can help me?
Yeah.
I'm really, really interested. Yeah.
Yeah, I'm sorry, but at this stage, Dr. Tida, I think if you can try work with us, trust me, you would not be disappointed. There would be no disappointment. The way that we've structured this program, it is going to help you to an immense degree, especially if you're doing, GP pathway, pesky exams, and even if you're looking for a hospital job, this is designed to help you. So see if you can work out your priorities. And I'm thankful, really honored that you've raised such a question. Normally people would not be very honest and upcoming about it. And I can understand that, having a busy family. Keep in touch on, we may have a discussion about it, how we may have to overlap you off with the second program and see how it goes. But if you can really commit to it, it'll be over in a jiffy, 1 month, it'll be gone.
Yes. Okay, so maybe I drop a line to you. I will send an email and want to get idea from you. Thanks a lot. Yeah.
So Dr. Tom has also joined us. Tom, nice to see you.
Hi everyone. Hello.
So
Hi,
we were
Dr.
just
Tom.
Hi, guys.
Hi.
Hi, Dr. Tom. Yeah, so I think, sorry, I just heard the later end of that question. And, you know, once we have things going, we should be having more placement locations throughout Australia, whether you're in different states. We're working with, I'm not sure if Dr. Rizwan has mentioned MyHealth, which is they're one of the largest GP groups in Australia and have over close to 100 clinics in Australia. So, of New South Wales, once we get things going, we should be able to expand into other states as well.
That's right. So no, I did mention it to them, Tom, about MyHealth, and I think it was a very important relationship. And part of it was that we wanted that commitment, as you said, that they are the one who are very invested towards the educational commitment of their registrar, like educational provider of the year, supervisor of the year from RSCGP. So I think it goes on really showing that they're really invested in terms of development of the doctors who are working with them. And Tom, you were also telling me about there will be also GP registrar there during these rotations.
Yeah, that's right. So again, they're one of the largest groups, and they have a really strong culture in education. And for example, they recently launched their own education platform called MyHealth Academy. So when you're at the placements, you should be seeing other registrars there as well. They, as you can imagine, with 100 clinics, they take on a lot of registrars. So I think maybe with Pesky, my impression is that's more for rural locations. But, even in the future for employment opportunities, it would be just really nice connecting with them, and having that background, I think, will be helpful.
And plus, they're growing at a very rapid pace. And I was mentioning that some of these doctors, once they get full registration, they're probably looking at the ins and out and the back end working of MyHealth, which could be their future employer, if not their partners, because they are a franchise, right? You go to MyHealth and open up a franchise of MyHealth. So it's a business opportunity as well at the same time.
Yeah, so I think with a lot of you guys, if you're focusing on the GP pathway in the future, I do think it's quite beneficial having that, that stamp of approval from MyHealth, saying that, you guys have performed well and so forth. So yeah, I think it, it should be really helpful.
Yep. And not only just for the GP point of view, as I said, that with our integrated Zoom session in terms of mentorships, plus the workshops that we're doing, I would also encourage you, if you are in Sydney, to come to Liverpool. And I think some of you are already registered to Liverpool workshop. But I like, now that we can, I like to see everybody personally as much as I can. And this is the first step towards achieving that in a more organized, in a more predictable fashion, that we're taking you on board. You're doing these face-to-face sessions with the GP, you're doing face-to-face courses, and it's 4 weeks only. Out after that 4 weeks of very intense learning experience, at least you've got that CV up to date with CPD hours, with clinical observership, with references, with workshops that really matter. So I can really see you getting shortlisted if your CP is optimized properly, which we're going to talk on that another face-to-face workshop on the last day at the concluding ceremony. So look, as much as I'd like to say this is very good, but it's something which I'd like to improve further with your feedback. So this is anything that you feel is not addressed, anything that you feel that can be done better in the program, in the structure, tell me and we'll make it happen for you. Within reason, obviously. So something which you can look into. It's not a static program, it's a dynamic program, it's a pilot program, it's a maiden journey with you guys. And if you want to take it on board, we'll be happy to sort of decorate this program. Now, in terms of the dates and timelines, I'll just mention that our closing date is on 15th of July, which would be in a couple of weeks' time. Thank you for sending me your CVs. I have got a lot of CVs right now, so I think me and Tom would have some time to really go through them and select the candidates. As I said, the selection process is pretty much making sure that which area you're living in or which area do you find more comfortable to commute. That's the main thing that we'll be sussing out. Obviously, the communication skills, because it's our pilot program, we want to make sure that you are really, really invested in this process. You want to make good of this program. So if you're enthusiastic, if you are passionate about it, if you are persuasive, it's a really important time, as I say, from the IMG perspective, because the first round of recruitment is just in the full swing right now. My whole week is booked out with interview sessions. Can you believe that, Tom? Whole week. I've just done an interview session this morning, one-on-one, from 9 to 10. Then I had to be in Bondi. That's why we were like so I rushed back home, and then I'm doing this session. And then whole week, next week, I've got like sessions throughout every day. So it's high time to have something working for you. And I know some of you guys may have worked on personal basis and personal reference basis with the GPs. This is completely different. We officializing everything. We're making sure that you're getting your assessment. We're making sure that you're part of a program in which the learning is not only by observing, but reflective. You're doing workshops. You're ending up with a face-to-face ceremony in which we'll get everything that you need to be ready for a job process. So second round of recruitment, which starts September, October, and pretty much goes up till the December mark, would be very, very important. It's a hot, important time for you. I cannot emphasize, most of the IMGs who are looking for their first job, for them, the period between September and December is super important. That's where you'll get your first job, because the doctors will get their first job or would have their job offer from the first round of recruitment. They will change. 30% of you, that's the statistic, will change, because they would have applied for 2 jobs, one closer to home, closer to their circumstances, one far away as a backup plan. They'll be giving up their backup plans. All right. And that's where you come in handy. Okay. They will be putting that job out and you want to grab that job. So the second round recruitment is super important for IMGs. So please realize there will be hundreds and hundreds of jobs coming between September and all the way up to December, and some even in January as a last minute ditch. And you want to grab on those jobs. Okay. And there's nothing which is stopping you apart from your own self-improvement. And this is a very vital step towards that self-improvement and commitment. You've done everything. I know you've been working very hard throughout the year. Let's just take it face to face. All right. Let's just add that Australian experience that everybody is looking for with a proper program. And don't worry about it. We'll word a very good and nice reference letter for you. Plus, on top of that, how to put that observership program on your CV and how to reflect the learning from the observership program into your application form will help you with that. So that this very important part of 4 weeks learning does not go to waste. It's optimized. All right. Any other question? Tom, you gonna add something? I've heard. Oh yeah. So the other thing which I wanted to add was in terms of fee, this program is a fee-based program. So it's the total cost of this program is 3,500, which is split in 2 equal payments. So first payment is registered at registration when you're selected. And the second payment is to be paid at 4 weeks time near the end of the program. And that's as simple as that. We've kept it simple, easy as, so you should not have any troubles in terms of that. And we'll send you payment reminder, no problem. And those of you who've worked with me, I can assure you it's going to be, you can pay via the credit card, you can pay via the PayPal, you can do a direct account transfer, and it's easy. That's the least of your troubles. Okay, all right. Any other question, guys? While me and Dr. Tom are both here.
So Dr. Rizwan, can I still submit my CV to you, right?
Of course, please do that. And your circumstances might change, Dr. Tida, and we may have you may opt for a GP practice where nobody else is opted for, and we might be able to look into and devise and working with you. I want to work with you. I think you're very invested. You're very enthusiastic.
Because the location wise, the location also very convenient for me because I have a family there also.
So right now you said that you're in India, right?
Oh no, because they are studying here in other country. I mean Singapore.
You're in Singapore, okay. So you want to come over from Singapore?
Yes. So
when are you arriving in Australia?
Sorry?
When are you arriving in Australia?
I have to plan well because based on your program, so I need to plan, take leave, and arrange for the kids, and then I come.
All right. Okay. Okay. Fair enough.
Yeah.
So you think that you might, I mean, the program start 26th of August. Do you think that you've got enough time in terms of organization? It's still a month and a half.
Yeah, I think I should be okay. Just that, I cannot stay the full month. Instead, like maybe split into 2 weeks, then come back to Singapore, then go back again. Or if you allow me like a 2-week squeeze, because based on the hours, CBD hours, is that possible or not? Instead of, like 7 days, I will be free staying there,
So this is what we need to really weed out and we have to make a personalized plan. The whole idea is that you should be ready for a job. As I said, that's the measurable outcome, to have a job. That's what we are basing it at. You should be getting shortlisted for an interview. If you're spanning and diluting your experience, it might not work in the way it's designed to work. So we may have to work out with you. Let's see. Keep the communication lines open. Send us your CV. We'll see how we go. If you pick up a GP practice which nobody else is interested in, if you're able to strike a personalized relationship with that practice, me and Tom may have to have a one-on-one meeting and see what we can do for you. But look, I mean, this is something which I'd really like you to see from the start to the finish, because just the way it's jam-packed, action-packed for a week. And me and Tom have been talking a lot about it, and I would really like you to be a part of it.
Yeah, thanks so much. Yeah, I also want to get some advice from you, because like my life really a bit difficult.
Shoot an advice for. Ask me a question.
Thank you. Thanks a lot.
Okay, perfect.
Yeah, Rizwan, Dr. Rizwan, I think adding to that, once we have things established and we have the program running year round, Theta, sorry, was that your name? We possibly can be more flexible, but I just think this first pilot run, we want to keep things structured and have the program start and finish in 4 weeks. So, maybe we can try to fit things in there, but it could be a bit tricky the first time round, I think.
Yeah, I also understand, but I plan to take the passkey, and
she's making all the journey from Singapore, Tom. I think there's been quite a lot of overseas interest and interstate interest as well. Okay, look, keep in touch. Let's see what we can. I don't want to promise something, because it will completely destroy the entire framework for everyone. We would like to still keep it to, because you may think it's very simple at our end. Trust me, it's not. It's taken Tom a significant amount of meeting, organization, how people are with the taking up or offering the GP, like a clinical placement. It's been so difficult. And right in the middle of Sydney, it's just been so hectic and chaotic. And if we start putting variations into place, they might not offer us the same level of spots for the next time round, which we're really looking forward to. We want to make it multiple states and all that. So let's see, keep on talking, and we'll see if we can work out and optimize that in some way.
Thank you so much. Yeah.
Anybody else has got any questions, guys?
So, Dr. Rizwan, I have something to ask.
Please do.
I'm Dr. Niharika, and I'm from India, and you already know. So I have my visitor visa on stand. So just for this program, like observership program, like if I'm getting selected, then I will be traveling to Australia, Sydney. So I was asking, so what about the chances to get selected, and what is the accommodation part, like how is it going to work? Like,
that's a very good question.
And
so you're Niharika, I know Niharika well. She's a very enthusiastic and very persuasive person. So Niharika, is your visa Have you already got a visa or not got a
Yeah,
visa?
yeah, it is. No, I have got a visa and it's still 2025 May. It's for 3 years I got a visitor
All right.
visa.
Okay, so
Okay.
you've got a visa, you want to plan a
Yes.
journey, but you want to be sure
Yes.
what's the accommodation like and
Right,
what's the chance of having a
The
placement confirmation.
selection. Yeah,
Yep, yep,
because I have a small daughter who is
yep.
2 years old and she will be staying in India. Like I will be traveling alone, like
That's right. That's
so
right.
yeah.
Yeah, look, I mean, depending on the practice that you've opted for and depending on the
Yes.
competition, we should be able to give you a pretty clear idea in the next week
Okay.
or two. Yeah.
Okay.
So
Okay.
if you're coming all the way from India, you've got a practice selected, I can, and both me and Tom can do your interview. And if there's
Okay.
no further interest and everything is on board, because I know you're also working in India in emergency department.
Yes. Yes, sir.
So there's
Yes,
a
sir.
lot happening at your end, and I really appreciate all that effort. And I think these are the kind of people who should really be prioritized. Tom, what do you think?
Yeah, look, I was just going to say that Dr. Rizwan obviously has been in this space for a long time and he knows it really well. And for me, it is something somewhat new. And I feel really privileged to be able to be a part of your journey. And, I've come to understand just how much effort, how difficult it is for a lot of you to, have an opportunity to work in the Australian healthcare system. So yeah, look, I'm sure myself and Dr. Rizwan will do everything we can to help where possible. And I think with this program, one of the good things is a lot of the locations are in Western Sydney, and that generally the rent's a bit cheaper, so you can live near the location of the practice. Yeah, whereas Eastern Sydney is a lot more expensive, so that might be able to help with accommodation things.
Yeah. So look, as the program matures, Tom, I think this is a very good question. We may have to look into having some proper hosts who can support and substantiate from some set amount of placements from overseas or interstate candidates. And if we can co-group them together into a single house with a shared space, which is not too expensive. At the same time, it's convenient to transport themselves walking distance or perhaps a bus hop away. That would be really good. So that is very good, Dr. Niharika. Let me look into it.
Thank you.
Thank you,
Dr. Rizwan.
we should be able to help you at least getting a position, definitely. And I'm not too sure about the accommodation at this stage, but I think it should not be a big issue accommodation wise.
That's okay. That's okay.
Yeah.
Okay. Thank you, Dr. Tom and Dr. Rizwan.
Not a problem.
Welcome.
Anybody else has got any question, guys? Any question? I'm more than happy to answer or discuss.
Dr. Rizwan, the radiology and adult resuscitation program you mentioned.
Yep.
Their fees will be included in this, or?
Everything's included in this fee. You don't have to pay anything extra. The total fee, including all the face-to-face, online, clinical orientation, are included in this workshop, in this 4-week program. So, and you'll have an access to portal. Everything would be uploaded onto the portal. So if if I would like you to see during the workshop, because that's how the workshops are going to be like interactive and question and answer based. But they will be uploaded onto the portal as well. So you can access.
And the Liverpool hospital workshop, which I think you mentioned, is same in this program or?
No, so that's a separate one. Liverpool is completely different. So if you want to register for the Liverpool workshop, it's a completely separate workshop. If you are interested in it, please do register. It is pretty much designed from your first hospital job perspective. Like, what skills do you need to work in a hospital space when you're working in a ward, when you're working in an emergency department, when you work in a surgical ward, pediatrics, everything. So that is super important. It's 2 days, and I've just finalized a list of faculty. It's amazing. You will trust me. People just have so much fun, make so many friends there, and I think you will not regret it coming to the Liverpool workshop.
And sorry, the last question. The link to the Liverpool hospital program, it's given on the website.
Yeah, so everything is on emergencyfocus.net website. So if you go there, it'll be CPD courses. If you click that, it will be under there.
Okay, thank you so much.
Not a problem. Has anybody else got a question?
Yes, I wanted to
Yeah,
ask,
Tripti.
as I said, we'll be facing interview for this role.
Mhm.
When would be, like, if we get selected, what would be the time frame we'd be sitting for it?
Within a week, Dr.
Within a
Tripti.
week, yeah.
So basically, we'll be prioritizing interviews. There's a lot of interviews. So me and Tom will probably have to sit down, shortlist, and then just do back-on-back interview. And look, I don't want you to worry about the interview process that you have to be in a place. It can be a phone interview. You might be busy at work. You can just take a 5-minute break, be on the side. We just need to listen to you, make sure that you've got communication skills, make sure that you've got your essentials ready, and what your priorities are in terms of placement. And then we should be able to populate our Excel sheet with the preferences and the GP placements available and see if we can match that requirement, and should be able to give you an offer within a week of an interview. Is that fair to say, Tom?
Yeah, definitely. So we'll try to work within that time frame. Yeah.
Yeah. When you said we'll get a phone call interview, but we'd be informed beforehand, right?
Yeah. So you will get, if you're shortlisted, basically the closing date of the program applications and sending the CV is on 15th of July. We will shortlist all the candidates from 15th of July to about 20th, probably about a week there. And then we'll conduct the interview from 20th till say about 25th, and we'll be sending the offer. So before August, we need to finalize everything, because MyHealth would also need a list of candidates who are coming to them. So we want to give them plenty of time to nominate their supervisor, allocate them. So when we're sending you your welcome letters, they should have named supervisor on top of that. Is that sounds reasonable, Tom?
Yeah, definitely. For sure.
Cool.
I think, again, I think we're coordinating quite a few things in between practices. We have to speak with the practice owner. They have to allocate you the GP supervisor. So it's just good to have these things finalized so we can have some extra time to make sure, you get a really good experience and you get the right supervisors, who are experienced at having medical students and registrars and so forth.
That's right. Good. So yeah, really quickly. So Dr. Sipti, you'll hear from us within, I'm saying a week, but hopefully as soon as we've conducted an interview, we should be able to send out the offers. And as soon as you pay, that will confirm your spot. So that would be the rate limiting step from you, that as soon as you pay, we've got the payment, we've got the placement locked for you, because once you've locked the placement, the only way to lock the placement is with first installment. Once you've locked the placement, done, then it's yours. Nobody else is taking it away.
Right. Dr. Rizwan and everyone, I'm not sure if you've already mentioned this, but I think the value of this program, I know that it's not a cheap program, and really the majority of the costs comes from us paying these GPs to
That's right.
spend their time and to be a supervisor. So that really is driving up the majority of the costs. But Dr. Rizwan has been very kind to, offer his other programs with this, within this price. And then both of us are investing a lot of our time to provide these weekly sessions, to, provide feedback, and just having a very structured approach. And what makes it really unique is you can go to a potential employer and say, hey, I did a placement with a certified RSCGP provider, and that is MyHealth. So they're a, really respected educator in the space, and you have official CPD points to match that, versus going to, your friend's GP and sitting in and getting a reference letter. So, and I, I've met a lot of international doctors, and I mean, Dr. Rizwan is an example, and a lot of you guys are amazing clinicians, and I think hospitals just need to know that, hey, you are that amazing clinician that you can be, to I think give you that opportunity to get the job offer. So I think this is what makes this program special.
Thank you, Tom. Now, I think this is a very important point that you've just raised in terms of costing. And we want it to be cost effective. And trust me, we try to negotiate, Tom and myself, to bring the price down as much as we can. They had a bar already set because they have got an expectation. They've got their own cost. They've got New South Wales. So there would be a lot of people actually with you. There will be UNSW medical students as well, Sydney Uni medical students as well. There'll be GP registrar as well. So they are educators, which is the most exciting part of this placement. They are educators. So they are in that space. They've got resources to teach, to train, and you should be using it to the max. So the cost is primarily be driven by their educational experience, which is our interest in them. And I hope this is sustainable. What we've done in response is just completely substantiated all our component to it in terms of face-to-face career guidance, which we're doing in RISB, all the weekly mentorship teaching between me and Dr. Tom, and all of the online stuff is just included in this. We just want to give you this value, which is cost effective. So you don't feel that, look, this is not happening. I want you to have everything, which I think is at minimum level to set you up for a shortlisting. So let's just make this happen, right?
Sir, I have one question. Can I ask?
Please do.
So I am Dr. Ramesa from Pakistan.
Yep.
So I do not have any GP experience previously. So do you think that is it going to help me? I just have a internship experience.
Okay. So look, one of the misunderstanding about this program, and I can understand this being a misunderstanding, that this is a program for GPs only. No, this is not the case. You're just having a clinical observership in an Australian clinical facility to see the patient assessment models in terms of history taking, examination, management, investigation, referral process, and with an integrated component of very strong communication skills. So I think this placement will set you up for a hospital job if you're looking for a hospital job in Australia, as much as it will set you up for anything else. So don't misunderstand this program as a GP oriented candidates to be a part of. This is designed to be primarily for people who are going to take up their first position in hospital. Please don't make any mistake like that. The crux of this program is to provide you with those core skills that you need as a junior medical doctor to work in a hospital setting. Yes, it's a primary medical setting, and we do see that, and Tom is one example of that, because me and Tom used to work together, is lots of first year residents and interns do get GP rotations as a part of their clinical experience in the first year. And Tom might be able to shed some light into it. Like when they're doing the hospital placement, they also opt for GP placement. So it's a part of their holistic learning experience to have as much diversified clinical experience. So when you're making your choice 1 year down, year down the line, you're making a very sensible and informed choice.
Yeah, definitely. So, it is depending on the hospital. Some residents do have the option of doing a GP term, and some hospitals have an integrated GP clinic within their hospital as well. So yeah, it is not uncommon for a resident to have that as a part of their training. But I think, again, going back to the value of this program, as an international medical graduate, for the hospital, I think the concern is, okay, we know that you're competent, most likely a very competent physician, clinician, but are you going to cope in the Australian environment? Have you communicated with a Australian person before? And do you understand the healthcare system? How does the referral pathway work? How does the Medicare system work? Things like that, just getting your head around how things work in Australia and what is the expectation from the patient during the consultation. I've never worked in Pakistan, India, Singapore, but I know that the style is very different. The time you spend with them, maybe even the history taking, things can be quite different. So I think that is the value in this. So you know what to expect, and the hospitals know that, okay, that's the level that's required as well of you.
And I'll take it actually further. It is a part of an interview question these days that, look, you've worked in India, Bangladesh, Pakistan for a certain number of years, and you've applied for this job in Australia. How would you cope with the differences in clinical practice, in cultural differences, in communication? And there's a way to approach that question. Some of it is clinical side of things, and some of it's cultural side of things, and some of it is understanding the communication in a broader terms of interacting with people. So clinical side of things is very easy to meet that, look, I've actually worked in much difficult and much less resourceful system back in Pakistan. And I think the core values in terms of patient management remain the same when it comes to assessment, taking history, examination. However, I think where the difference is in ability to understand the patient and how to properly investigate based on those understanding. And here I have got this 1 month of clinical experience working in a placement where I learned specifically those issues. So I think it will work it will hugely work in your benefit from that point of view to demonstrate that you have really oriented yourself, not only from the point of view of previous experience, but working here, and also, doing these mentorship meeting, which I think is a very crucial. I'm actually, if you ask me, I'm more excited about the mentorship meetings every week because I think the best learning comes from reflective practice. I think about the case which I've managed and how would I have done differently? What would approach be if I get the same patient next time? So definitely, I think if we just say that you're doing a GP placement, it is very easy for us to do. In fact, it might limit our terms of, it might provide us more freedom, me and Tom. But I think when it comes to value and in terms of having that sustainable learning process throughout, it's sitting down and discussing those cases. So that's where we differ. And one of the universities actually do that. So when the local graduates see the case in the hospital, they actually incorporate that as a part of their logbooks and they discuss it with the clinical supervisor. Look, I've had a very interesting case. I'd like to share it with my group and just tell me, what is this case about? What does it mean? Because it is a possibility and that you may not be able to get a complete understanding within the time constraints in the GP practice. But when you bring that case to the table, we might be able to solve that case together. So it improves your medical understanding as well. Any other questions?
Hi, Dr. Rizwan and Dr. Tom. My name is Mehul Kumar Patel.
Yep.
I'm really keen to join this course.
Yep.
It will be like a life jacket for me. I have been trying to get back to medical system in Australia, and this will act like a bridge for me to go into the medical side. And I live in Western Sydney as well, so I hope
that is wonderful.
So I hope it will give me a chance to go back to this medical field.
Excellent, not a problem.
Amazing.
I think we'll definitely. You've sent me your CV, right, Dr. Patel?
Yes, I did.
Okay, perfect. Definitely, please expect a call from us.
Sure. Thank you. Thanks, both.
It's good to see the people so that it becomes an easier job to shortlist. So let me just bring my list out.
Dr. Rizwan and everyone, I just want to add as well that, I think realistically, if we weren't doing the weekly sessions, we weren't getting to know more about you and how you're going with the placements. We're not confident in giving you a strong reference as well. So, it's not like we can just close our eyes and say, oh, everyone was superb and, they will do amazing. We need to know that you guys will integrate well into the healthcare system. So I think that's what the weekly sessions are for, to maybe adjust how you're communicating. Or I think the cultural differences, I've always thought that is a big one, that, what do you expect from other doctors and what do you expect from patients, and vice versa, what they expect from you. I think that you'll get a very good grasp of that in the 4 weeks and just get a good feel, which, you can be the best at passing these exams. I think that's something that's irreplaceable, having that in-person experience in the clinics.
All right. Okay. In fact, what we'll do quickly to make my job easier, because I don't know if I'll get the, can you just mention it to me, Dr. Patel, what practice amongst these practice would be feasible for you?
Yes, so I live in Western Sydney. I live in Schofield. So Parramatta, Wetherill Park, they are the closest one, but I'm happy to travel to any distance.
So Parramatta would be option 1, Wetherill Park would be option 2.
Yes.
Perfect. Okay, Dr. Tripti, let me take your preferences as
Thank
well.
you, Dr. Rizwan and Dr.
So I live in Tungabi. So
Okay.
Parramatta is number 1.
Yep.
Wetherill Park and Auburn can be the next one. But
Okay.
as Dr. Patel said, I can travel anywhere
Perfect.
if needed.
No, it's good to have flexibility. I'll put a star on flexibility because obviously you get the first choice being the primary people, but then if you can commute, then that would be also good. 2 sessions a week shouldn't be a problem. And which Auburn you said is also close to, Auburn is close to Tungabi, right?
Parramatta is closest to
Closer,
Tungabi.
yeah.
Wetherill Park is like 15 minutes drive from Tungabi.
Okay. Yep.
And Auburn would be 15 to 20 minutes. Yeah.
Fair enough. Okay. Dr. Niharika, I don't think that she's on, but I would say.
I'm here, sir. I'm here, sir.
So your preferences would be.
So I'm traveling from India and I have no clues. That.
Okay.
So
Dr.
I have been in
Rizwan.
I think let me suggest, what do you think,
Yes.
Tom, if she was coming as a, let's just help her out.
Yeah,
Where would she
I
be
think-
having a best chance of scoring a cost-effective accommodation? Would it be Parramatta? So the question I'm asking that if she's coming from India,
Yes.
where could she have a cost-effective accommodation in any of those sites?
I think, look, I think the Parramatta might actually not be the cheapest option because it's, getting pretty crowded there. I think Oran Park might not. Look, I actually need to do some research, but I think
okay, let's just put her
away,
down.
Away from Parramatta.
Yeah, let's just put her down for Wetherill Park and Auburn. I think Auburn, there's a lot of Indian and Bangladeshi community and Pakistani community, and and there's a lot of risk.
Auburn is not cheap.
It's not cheap. Okay.
Parramatta and Auburn, there, it's like centrally located. A lot of people are there, so the rent is really high. Yeah.
All right,
guys. I think MacArthur Square, which is actually
also that. Oran Park is expensive as well.
Everything is expensive in Sydney these days, right?
Yeah.
But look, we're talking about a shared accommodation. We're not trying to have an independent accommodation. So we're talking about shared student houses with female students. So that should not be a problem.
What's the budget?
I'm flexible with all placements. So I have nothing like whichever comes across. I'm okay with that.
All right. Okay, that's good. So I'll just put a star on there. Flexible. All right.
Okay.
Dr. Rizwan, can I also offer some places?
Yeah.
My first priority is Oran Park, and second would be MacArthur Square, and then that will be Wetherill. Yeah.
MacArthur Square, and third would be the Wetherill Park.
Yeah.
Can I just ask everyone, what's the budget that you guys are looking at when it comes to accommodation?
I think it's just only applicable for Dr. Niharika, but I'm not sure if there's somebody else would be interested in it because there are quite a few participants who might be traveling.
Yeah.
So
I don't need the accommodation actually.
Okay.
Yeah.
Dr. Rizwan, sorry. Can I offer my preferences as well?
Yeah, who are you? So I've only got people who, if you turn your camera on, at least I can see you and I can understand who is that, because it's easy to have a person seen. All right. Yes. So
Dr. Varsha?
Is it Dr. Varsha, is it?
Yeah.
What's, are you still, Dr. Varsha, can you tell me your full name?
So Dr. Varsha Wase, W-A-S-E.
W-A-S-E. Yep.
So
all right.
South Everly.
Yep. So what's your first preference?
South Everly.
South Everly.
Then Parramatta.
Everly plus Parramatta.
And Auburn.
Plus Auburn.
And I'm flexible as well.
Sorry, what? Flexible as well.
Flexible.
Okay. Now, Tom, is there anything in Liverpool? Because I know that rents over there can be okay. Like I think probably reach out to MyHealth. I think they may have some practices over there. We might be able to take some more people on board. And then I've got iPhone there. That's Dr. Niharika, I think.
Yes, sir.
Okay, all right. Yes. Anybody else would like to? Oh, Dr. Sochi, right?
Yeah.
Dr. Sochi. Yes, tell me, Dr. Sochi, what's your preferences?
Yeah, Parramatta and Wetherill Park.
Parramatta plus Wetherill Park. All right. Okay. Perfect. Thank you for that, Dr. Sochi. Anybody else who would like to express their interest now? It will just make it easy.
Hello, doctor.
Yep.
This is Dr. Shahinda. I live here in Blacktown, Sydney.
Okay. Just turn your camera on, Dr. Shahida, so I can have a look at you and have got some memory. Okay. All right. Thank you. Thank you. Yeah. Dr. Shahida, can you tell me your full name, Dr. Shahida?
It's Shahinda El-Gilad.
El-Gilad. Is that Shosho, right?
Yeah.
El-Gilad.
That's right.
And you've already sent me your CV.
Yeah, I did.
So now what will happen is that it'll become easy for me to see you and then pick up your CV from all the sea of CVs that me and Tom has to go through in a week. Yeah. So what's your preference, Dr. Shahida?
The closest thing is Parramatta and Auburn, but I don't mind either.
Okay, Parramatta plus Auburn. Perfect. Anybody else, guys?
So can I also add my preferences?
Yes, please. Romasa, sorry.
So
what's your full name, Dr. Romasa?
Romaisa, Romasa Irfan.
Irfan, perfect. Thank you. Yes, please.
So
go ahead.
I live in Campbelltown, so I would prefer Macarthur.
Macarthur.
And
that should be pretty easy, right?
Yeah.
Maybe you can host Dr. Niharika.
Okay.
She'll pay you some rent.
Yeah, sure.
All right.
Okay. And my second preference will be Oran Park.
Oran Park, okay.
And third one will be Wetherill Park.
Wetherill Park, is it? Wetherill Park. All right, perfect.
Thank you.
And anybody else? I've got Dr. Anika Alam, sorry.
Hi, doctor.
Hello.
Yep, go ahead, please.
Can you hear me?
Yep. I can hear you. Who's that?
Dr. Rizman, we've got some messages in the chat as well.
Oh, just let them, can you chat back, Tom, and let them know to turn their camera on so I can just see and just link it up. Dr. Edelton, I've got. Dr. Edelton, you want to say something?
Yeah, I was just going to say my preferred spots. I just wrote on the chat, but I'm going to say it to you again.
Me, because it's difficult to check the chat and
okay, my first one would be South Adelaide, the second one Warringah Mall, and the third one Auburn.
Adelaide. So South Adelaide is the first one. Second one is third one is Auburn.
Yes, and the second one is Warringah Mall.
Warringah Mall, okay.
Warringah Mall, okay.
Warringah Mall, perfect. Okay, and I've
Thank you very much.
Anika Alam, I think she had her camera on for a while. Yeah, Dr. Anika.
Yes, Dr. Rizwan?
Yep.
Yes, hi. So I live in Homebush, and my first preference would be Auburn. And second would be Parramatta. Yes, and I can also, I'm flexible, so that's all right.
Okay, I'll get you a star. All right, and I've got Dr. Alice then, and Dr. Maria, sorry, Dr. Maria goes first.
Hey, so I live in Smithfield, so ideally Wetherill Park would be my first preference, but honestly, it really doesn't matter. It's all good.
Okay, all right, Wetherill Park and star. All right, excellent. And then I've got Dr. Alice.
Yeah, so apparently Dr. Alice can't unmute. She's got a very busy background, but She's from Zimbabwe, and she's asking if we can consider applicants outside of Australia.
So we can. You can come in, but you just have to sort out the visa at your end. We can provide you with a letter that you're enrolled and successful in the program of GP Clinical Observership, but you have to do your own visa. We don't look out obviously can't look after that side of things. So just send us an email. I will try get you a letter, and please, I think for you, the preferences don't matter. And we should be able to sort of sort something out if we can, if we have got like 10 placement and we can sort it out. Okay. All right. Not a problem. From Zimbabwe. All right. Excellent. Anybody else who I have missed, guys?
Dr. Andrea in the chat. Did you
I'm Tanu.
Okay, Dr. Tanu. Just give me a second. Dr. Okay, Dr. Andreas, I can see Dr. Andrea. Dr. Andrea, and your surname, please?
Pinzon. Pinzon.
Perfect. Okay. Yes, Dr. Andrea, can you please tell me your preferences?
I would prefer Waringamo as my first option, and the second option is I work in Parramatta. That will be as well.
All right. Okay.
But
Waringamo, Parramatta. All right.
Thank you.
Perfect. Perfect. All right. Excellent. Anybody left, guys?
Yeah, Tanushree, Tanu.
Dr. Tanu. Yep. And what your surname is, Dr. Tanu?
Roy, R-O-Y.
Roy. Perfect. Yes, please. Tell me about it.
Yeah. So Parramatta would be number one.
Mm-hmm.
And then Wetherill Park would be all right.
All right.
And then Auburn or other places, but around Parramatta should be better.
Sure. All right. So it looks like Parramatta is on the top list of everyone. Okay. All right. Not a problem. Okay. Okay. I think that's about it. Oh, Marco. Got Dr. Marco there.
Hello, doctor. Yes, my preferences are Auburn and second one Parramatta, but I can take any place.
Okay. That's good, Dr. Marco. Thank you very much for that.
Welcome. Thank you so much.
All right. Anybody else who I may have missed, guys?
Yes. Hello, doctor.
Okay. Can you just tell me your name and have you got your camera on? Dr. Pooja, is it?
Yes, I'm Dr. Pooja. Actually, doctor, I'm from South Australia, so I'm more than happy to take any of this place.
Yeah. Oh, yeah. South Australia. All right. And any place. Perfect. That you should not be a problem, Pooja. I'll definitely try to facilitate you, because if you're flexible, then and you're making all that journey as Niharika is, we'll prioritize you people to come and join our program. And look, thank you very much for that.
Thank you.
All right. Excellent. I think that's pretty much it. Tom, have you got anybody else?
Not that I can see. No.
Okay, that's fine. I think for 10 placement, I've got 17 here right now. So we have to do a little bit of prioritization. I think that would be at our end. And anybody that we may have missed, then just let me know by email or we'll take it from there. Okay, excellent. So any further questions, guys, or are we done on this bright and beautiful Sydney afternoon? All right, so we're done, I think. Dr. Edelton, do you have any question, or you okay?
No, I'm okay. I'm just gonna mention that I'm from Brazil, and I'm gonna need to look for accommodation as well. So if we got selected, we can create a group and try to find some accommodations together.
Yep, Dr. Edelton. So
I just applied for the working holiday visa today, so I might be able to come to Australia in time.
Okay, not a problem. So perfect. Niharika. All right, perfect. And there was Dr. Tita from Singapore. So we got 1, 2, 3, 4 people out of station. Well, 3 people from out of station and 1 people from interstate, and rest of the people are from Sydney. Perfect. Excellent. Wonderful, guys. Thank you very much. and I hope I can meet all your expectations. Please keep the channel open. Send me an email, info@emergencyfocus.net, as you know, and we'll contact you.
Thank you, Dr. Rizwan and Dr.
Thanks,
Tom,
Dr.
for
Rizwan.
such a
Thanks,
wonderful
Dr. Tom.
session.
Not a problem.
It was an amazing session on Sunday. Like,
Thanks for the opportunity.
I'm really looking forward to it. Trust me, I am super excited.
And
Tom, you might like to just stay here. We just need to have a little bit of chat after.
Yeah,
the
for
session.
sure.
Okay.
Yeah. Thank you so much,
For sure.
everyone. Really
Thanks, everyone.
Thank you.
Thanks, all the participants. Thank you.
Thanks.
Thank you. Thank you.
Okay. Just
maybe we'll
just
there's the one
removing.
left.
Yeah. All right. Perfect. I think it just leaves us. Let me just stop sharing and stop recording then.
Sure.
Stop sharing.
Sorry for joining late, Rizwan.
No, that's all right. I was wondering, where are you?